I wasn't going to do this, but JoEllen, I'm going to tell a little bit of a personal story, and if you just don't mind for just 1 second. But my mom was a patient at Mayo Clinic many years ago, and she had been going from healthcare setting to setting with a dermatologic issue. And I said, Mom, I'm going to take you to the Mayo Clinic. We made it to Rochester, a great now city, so much different than it was 20 years ago. And we walked into the unit where she was going to be directly admitted. And the nurses there, a couple of them, met my mom, put their arms around her and said, we know exactly what you're dealing with. We're going to take care of you. And off she went, and she just started weeping. She had been suffering for months. And it is that passion, that love, that caring. We'll never forget it. And so it embodies, I think, what you're all about at the the direct patient level. But if you were to think about sort of the ideal state for healthcare going forward, and kind of thinking about all the things we've talked about in the last 40 minutes or so, where would you like to see healthcare go? What is your ideal state and your dream, perhaps?
It's such a great question. I'm a mom of a recent college graduate, one that's in college and one that's in high school. I would love a future of healthcare where all three of my kids were committed to mankind, committed to professions within healthcare, and committed to kind of starting off that path. Unfortunately, I don't think that's the case. And so what I hope for healthcare is that all of us dig down into our why. And again, it may seem Pollyanna, it may be, but we all can remember the reasons why we came to a healthcare organization. We can understand why we went into the healthcare profession, some being direct patient caregivers, some others being support. And if we can't look ourselves in the face and say, I get the why, I get why it's important, how are we going to pass that on to the next generation, of which all of us are going to rely on for care? So that would be one thing that I would love to change about healthcare, is just that inspiration of the next generation of what a meaningful, fulfilling, and enriching career healthcare can be. How we get there, though, is we have to change what our practitioners and our front lines are feeling today. And that's where the hard work is. I do believe that, and again, I think I shared that I started during a nursing shortage in 1999, where nurses were hard to come by. And that's going to continue. That is not a new problem, but how we solve the problem may be different than how we solved it 25 years ago. Mm-hmm. And what I think we need to do as a healthcare kind of system is to really look at where we need the healthcare professionals and not remove the person from the care, right? But ensure that we're having a system around these healthcare providers that are becoming more and more finite, that allows them to do what differentiates that level of care. So how do we automate things that don't bring value? How is it that we leverage other skill sets or other resources to help that? And that's what we're pushing ourselves through right now, is really how are we reimagining care, knowing that we're not going to compete and recruit and kind of claw our way out of this challenge, the staffing challenge, because it will continue to face us. I think we have to help people understand that this is not a replacement for those direct patient care staff. It is an acknowledgement that our workforce dynamics are changing. Less people are going into healthcare. The need for healthcare is growing exponentially and will for the next 10 years. Healthcare is going to be one of the fastest growing sectors in the labor market. And we just are facing a workforce challenge that needs to be solved in a multitude of ways. So it really is that inspiration of that next generation to come in to be healthcare providers and ensuring that we can look them in the face and say, you will be in a purposeful, meaningful, beneficial career. And the second thing is we really solve the hard problems around how do we support and augment the workforce in order to let them be what we need them to be, which is directly there to support the highest needs of our patients. And so I think it's those two things that I wish for healthcare.